Good evening.
¿Qué tal? Son las 19
How are you
horas
doing?
en punto del jueves
It's
28 de mayo
exactly 7
de
o'clock
2020. Estamos en el Palacio
on
Nacional
Thursday,
de México, en la Ciudad
28th
de
of
México,
May.
y vamos a
We are
iniciar
at the
la
National
conferencia de
Palace
prensa
in
diaria
Mexico
sobre la
City.
situación de la
We're
pandemia de
going to
COVID,
begin with our daily
la epidemia
media
causada por el nuevo
conference
virus,
on
coronavirus
the pandemic for
SARS-CoV-2.
COVID-19,
Hoy nos vamos a
which is
enfocar a dos
created
elementos. El
by the
primero es el informe
coronavirus
técnico y el
SARS-CoV-2.
segundo, la parte
We're
temática.
going to focus on two
Tenemos el
elements.
privilegio de que
Number
nos
one is going to
acompañe
be the
la
technical
directora
point,
general del Consejo
and then
Nacional de
for the
Ciencia y
theme
Tecnología, la
today,
doctora María
we're
Elena
going to have a
Álvarez Builla
special guest,
Rosas. Bienvenida, María.
Dr. Maria Elena
Asimismo,
Alvarez.
Paola Villarreal,
Welcome.
quien colabora directamente con la doctora
And
Álvarez
Mrs.
Builla,
Paola, who
y
works directly for
vienen para comentar
Dr.
sobre algo
Buya,
que ha sido
and they're
extraordinariamente
both
importante
here
para
to touch on
nosotras y
something that
nosotros,
has been
que es la
extremely relevant
contribución de la ciencia,
for
la
all of
contribución de
us,
grupos
which is
académicos,
the science
de
contribution
principalmente dos
and the contribution from academic
grupos de
groups,
instituciones.
mainly
Uno es los
from
centros públicos de
two
investigación
groups of
CONACYT,
institutions.
y lo segundo
One is
es
the
la Universidad Nacional Autónoma de
Public
México.
Investigation Centers,
Y
CONACYT,
ellas nos van a
and
explicar
our
cómo ha sido
National
la
University,
interacción
UNAM.
con el gobierno de México,
They will
cuál ha sido
both
el papel de
touch
la
on what
ciencia
has
para
been the
orientar las
interaction
políticas
with
públicas, la
the Mexican
respuesta
government
en
and what's the
autoridades de
role
esta
of
pandemia,
science in
y
terms
verán
of
que
our
justamente las
legislation to
personas que
surveil this
ellas van a
particular
mencionar
pandemic.
son
You
quienes
will
han
notice
producido
that the
estas
people they
muy
will
útiles
talk
y
about
sólidas
are those
proyecciones y predicciones
who have
de las curvas
created this
epidémicas,
forecast and
y
chart
también las
of our pandemic curve,
estimaciones sobre movilidad pública, los
and
mapas de
also
riesgo que dieron
the
lugar al
forecast on
semáforo,
public
etcétera.
mobility, the
Son
risk
nuestra base
maps that
intelectual y
develops the
científica
stoplight,
que
and
nos ha
so forth.
robustecido muchísimo.
They are
Bienvenida.
our intellectual and scientific
Te
base
voy a
that
permitir
has been of
entonces
tremendous help.
darle
Thank you so
para
much and
presentarte
welcome.
personalmente el
So
informe
let me
técnico,
stand up so that I
y
can
enseguida le doy la
present the
palabra
technical
a la
report for
doctora
today.
Álvarez Builla.
And the floor will be given to the Dr.
67 días de la
Alvarez
Jornada
right away.
Nacional de Sana Distancia. Nos
This is
quedan
67 days of the safe
tres días,
distance
formalmente
campaign.
2 días,
We have
porque la
3
jornada
days
termina el
left,
30, el domingo
officially 2,
31
because
es
the day is
el día
really
de
over
asueto,
on
convencional,
30, and
pero
then
podríamos
Sunday
aprovechar todavía
31st is
para
a day
quedarnos en
off,
casa, para
but we
aprovechar
could
estos
still take
últimos días,
advantage of
y
it and
aunque parecen
stay at
pocos
home
días,
to
cada
take
día cuenta, cada día
advantage
es
of these few days.
importante
And even though
porque
they look
reduce
as
la
if they were very little days,
velocidad y la
every single day
probabilidad de que haya
counts as
contagios. Como hemos dicho, la Jornada Nacional de
as
Sana
it
Distancia
reduces the
tiene como
probability for
propósito
transmission.
fundamental
As we have
que las
said
personas
before,
eviten
the safe
contagiar
distance
y eviten
campaign
ser
has as a
contagiadas.
basic purpose
Y la consecuencia
a
positiva,
prevention
que
on
es el objetivo
transmission
buscado,
or to be
ha sido
transmitted
la
on
reducción
both ends.
de la velocidad de propagación de la
And our
enfermedad
objective
y
has
por
been a
consiguiente
reduction on
la
the speed of
reducción de la
transmission
velocidad con que
of this
aparecen
disease,
nuevos
and
casos.
hence
Y es lo que
we get to reduce the
lo que le hemos
speed
llamado el
on which new
aplanamiento de la curva.
cases are tested
Vamos a ver los
positive,
datos.
which what we have
En
labeled
primer
as
lugar, tenemos la
flattening the curve.
información
Let us
internacional
look at the
tomada de
information.
los datos que
So
publica la
first, the
Organización Mundial de la
international
Salud,
information that we
y vemos
gathered
en síntesis
from
que
the
más de
published papers from the
5.593.000
WHO,
personas en el
and we
mundo
see that
han tenido COVID
over 5
desde
million,
que empezó esta epidemia.
5,093 and
24% de
631
ellas, que son
people have had
1.345.000,
COVID-19,
lo han
25%,
tenido en
which
los últimos
represents
14 días y son la parte activa de la epidemia. La
1,345,039
región de
are
América
the active
ocupa
pandemic for the
la
past 14 days.
representación de
And in the American region,
54.8% de lo que ocurre
out
en los
of
últimos 14 días en el mundo, y
54.8% of what
la región
happens on the past
europea
14
cada
days
vez
across the
va
globe,
disminuyendo su
and the
representación
European
en la
region
medida que
as
las curvas
it
epidémicas, la
lowers
epidemia
its
en los
exhibit
países
on
europeos, que en su momento fueron los
this
más afectados,
chart as the
va en
curve
un
flattens
claro
on the different
tendencia de
countries in the
descenso.
European
No en
continent,
todos, pero en la
and they are
mayoría.
definitely
En cambio, las
in a
regiones del
descending order.
Mediterráneo
Not all
Oriental
of
y
them, but most of
Asia
them.
Sudoriental se
Unlike
están
Middle
empezando
East
a
and
aumentar. La siguiente.
Southeast Asia, that
En
continue to
México,
increase.
81.400 personas desde el
In
28 de
Mexico,
febrero, fecha en la que vimos el
81,400
primer caso
people have
confirmado,
since
han tenido COVID y han
February
sido
28th,
confirmadas
which was
por,
our first
por los métodos de
positive
laboratorio por
result,
esta enfermedad.
and has been
De ellas,
confirmed through the different
16.315
laboratory
lo han tenido en
testing.
los últimos
Out of
14
them,
días, por lo tanto es la parte activa de la
36,131
epidemia en
have
México,
had it
y
in the past 14
desafortunadamente
days,
ya
which is what we
9.044
can consider the
personas
active
han
pandemic
perdido la vida
in
por
Mexico. And
el COVID
unfortunately,
como consecuencia de la expresión grave de esta enfermedad.
9,044 people have
Más de
passed away
254,000
out
personas han
of
sido estudiadas, en su
this
momento han
disease.
sido reconocidas como casos
Over
sospechosos, se les han tomado muestras
254,000 people
para
have been tested
diagnóstico por
and
laboratorio
labeled
y el
as suspicious
resultado o
cases.
bien en casos
Samples have been
positivos
taken so that they can be tested in
81,400
the lab,
o
and they have either turned out positive as part of this
137,263
81,000
descartados.
number or
La siguiente,
as
por favor.
part of the 263 plus
En el mapa
that have
de
been
la
discarded
incidencia
for this test.
acumulada a lo largo de este periodo, desde
On
el 28
the
de febrero,
cumulative rate for
identificamos
this
que
time
63,7
since February
personas
28,
por cada
we
100,000
have
habitantes en México
identified
en algún
that
momento de todo este
63.7 out of
tiempo han tenido
100,000 inhabitants
COVID y
in
lo han
Mexico City
confirmado, se ha
alone
confirmado.
this period
La
have had
siguiente diapositiva
COVID
nos
and
muestra
has been
precisamente lo que el mapa
tested
revela, que es la
positive.
distribución
The
de
next
acuerdo
slide
a distintas entidades
depicts what
federativas.
the
Y
former
podemos
map showed,
reconocer que
which is
la zona
according to the different
metropolitana del Valle
states.
de México
We are able to
persistentemente y hasta
recognize
este
that
momento ha
the
sido la que ocupa
metropolis in
prácticamente la
Mexico
mitad
City has
de los casos
permanently, up to this
acumulados. La
point,
razón es obvia, la
is
hemos
at
dicho
the
una y otra
forefront
vez,
on the
es la
half of
zona
the
más
cases
poblada.
of the
Casi
cumulative
la cuarta parte
cases in
de
the
la población
country.
mexicana, un
Of
poco
course, we
más del
have said this before, this
23%,
is the most
viven en el
crowded
Valle de México.
area in Mexico City.
En la siguiente,
Over
lo que podemos
33%
apreciar
of
es
the
los
Mexican
casos
population lives in the Valley of
confirmados
Mexico.
en los últimos
On
14
my
días,
next
que son la
slide,
parte
you
activa de
can
la
appreciate the confirmed
enfermedad,
cases
y
for the past
notamos que lo
14
hemos
days,
notado en
which
varias
are the active
ocasiones
part of
como
this pandemic.
existen variaciones.
And we have
Recordarán que
noticed
Durango
before
estaba en color
how
verde,
there are
lo que
some
quiere decir que tenía
variations.
menos de 100
You will
casos,
remember that
pero ahora
Durango
está
was
en
in
color
color
amarillo,
green, which
lo que
had
quiere decir que
over,
tiene entre 100
I'm sorry,
con
less than
1 y hasta
100 cases, and
250
now
casos.
it's
Lo mismo
yellow.
Chihuahua ha
So
estado
that means
variando,
they have
de
had
repente más de
101 plus
200,
cases,
más de
just
100
like
casos, a
Chihuahua,
veces
they have
menos de 100
been
casos. La
fluctuating
siguiente,
between 100 and 200 cases,
también la zona metropolitana
give
del
or
Valle
take.
de México es la zona que
On my
tiene la
next slide,
mayor
you can
cantidad
see
de
how
casos
on the
recientes, casos de
metropolitan
los
area of
últimos
Mexico
14 días.
City,
Esto es
we have
relevante
the most
porque esto
confirmed
habla de que
recent
sigue
cases.
siendo
This
la
is
parte
really
más activa
important
de la
as
epidemia.
this
También
shows that
la
this is the most active
transmisión es
zone
más
on the
activa,
pandemic.
desde luego, en el Valle de
Also
México.
on the
Ahí se
highest
puede ver,
transmission rate,
también
of
prácticamente la
course,
mitad
in Mexico City.
ocurren los casos
Here you
nuevos
can see
en
it
el
on
Valle
the
de México,
graph.
y después le sigue con un
More
cambio
than
que se
half
puede
of the
ver
new cases are taking
notoriamente
place in the Mexican
importante
Valley, and
en
there,
las
there is
otras
a
regiones,
drastic
las otras
change
entidades
that's
federativas,
also very
empezando por
important for
Baja
the different
California,
regions
Tabasco, Veracruz,
in the
Puebla,
different states,
etcétera.
starting
En
with
la
Baja
siguiente
California, Tabasco, Veracruz,
diapositiva,
and so on.
lo que vemos es el mapa de incidencia.
On
La
this
incidencia nos
next
permite
slide, you
comparar
can
entre
see the
poblaciones de
incidence
distinto
map.
tamaño
This
y
allows us
poder
to compare
comparar en
within
una manera
different sizes of
equilibrada,
population
digamos justa,
and
apropiada,
helps
cuánta
us
intensidad de
to
transmisión o de
fairly compare
ocurrencia de enfermedad
the intensity of
existe
the
en las
transmission
distintas entidades
or the
federativas.
incidence
Esto lo podemos
may
ver en
there
la siguiente
be in the
diapositiva,
different states across
también
the
con
nation.
un gráfico de
You can
columnas,
validate
en
this
donde
information on
reconocemos
this next
también
slide
la Ciudad de
through
México
my graph
nuevamente
with different
como la
columns,
zona más
in which we acknowledge
con
Mexico
intensa
City
transmisión.
with
Y desde ayer, lo comentó el doctor
the
Alomía,
highest
hemos
transmission
incorporado
rates.
este sistema de
And
doble
yesterday, Dr.
barra, o de
Alomia
doble
mentioned
columna,
that
unas en
we
gris,
have
que son los casos
incorporated a
activos del
double
8 al
bar,
21 de mayo, y en
a
este
double
caso los
color
verdes, que
bar,
son los
one
activos
gray, one
del
green.
15 al 28 de
In this
mayo.
case,
Esto lo que nos
green
permite es ir
represents the
viendo
active
el
cases
cambio que
from the
ocurre
15th to the
en
28th of
la
May.
incidencia,
And
el
this
cambio
allows us to see
esperado o
the
deseado
changes on the
es cuando
incidence rate
empieza a
or
cambiar
the
la
expected, or
comparación
to
de las
see
barras.
the
Tomemos como ejemplo
expectancy
Querétaro,
that we have when the
los casos
bars are
activos
not
entre
parallel.
el
For example, in
8 al 21 de
Querétaro,
mayo
the active
fueron
cases
mayores a los
are
casos
between the
activos del
8th and
15
May
al
21st
28 de mayo.
are
Esto es
higher
como una
than the active
ventana
ones
móvil
from the
de
15th and
observación
28th.
de lo que va
This is
ocurriendo. ¿Por qué lo ponemos ahora y
an
no lo habíamos
open
puesto
window
antes?
that
Primero,
allows us
porque
to see
es
what's
una
going on.
innovación
Why
del
do we do it
grupo que
now
hace
and
el
not before?
análisis.
Well, this is an
Segundo,
innovation
porque
process
correlaciona con
from
el
the group that
semáforo.
helps us
El semáforo
gather
de
this
riesgo
information.
COVID
And second
que
one, it
presentaremos
has a
mañana
direct
formalmente
relationship with our
está
stoplight that
relacionado
we will be
precisamente
presenting
con
tomorrow
este cambio
officially, at least,
en la
which is
ocurrencia
connected
de
to
la
this particular change
intensidad
in
de
the
transmisión. Cuando empieza a descender la
incidence
curva
and the
epidémica, se ven
intensity of the
esos cambios.
transmission.
Los
When
casos
the
de un
curve
periodo
is
previo
flattened,
son
the
mayores a los
changes
casos
come
de un
about,
periodo posterior.
and the changes from a
Otros
prior
estados se
period
pueden
seem
ver
to
ahí,
be
pero
more
los vamos a
obvious
ir
than a
destacando de
post
acuerdo a lo que
period.
ocurra. La siguiente.
Changes are visible on screen, but we'll be highlighting
En
them
cuanto a las
as they
defunciones, ayer
take
explicamos con
place.
cierto detalle cómo estas defunciones
When it comes to
lamentablemente
our death
han
rate,
ocurrido y seguirán ocurriendo
we have
mientras siga
said
activa
how
la
unfortunately these
enfermedad
deaths have
y
been
mientras siga
happening
activa
and
los
will continue to
contagios
happen
y
for
haya
as long as
personas
the
que
pandemic
tienen
continues to be
condiciones de
active
riesgo
and
y
transmissions
otra
are
vez
in
hemos
place
insistido
and people
en lo
with risk
desafortunado que
are
México tenga
exposed. And we have insisted
sendas
over and
epidemias de
over again
enfermedades
on how
crónicas,
unfortunate
diabetes,
it is
obesidad, hipertensión,
that Mexico has
tabaquismo,
a
que
lot
tienen que ver
of
con
diseases such as obesity,
muchos años de
diabetes,
mala
smoking
alimentación y
problems,
también
and
de
others
políticas
that
insuficientes, por
are
ejemplo,
a
para el
direct
control
relationship with
del tabaco.
years of malnutrition
Y lo que
and
podemos ver ahora
insufficient
es
policies
esta
on
situación que ustedes ya
smoking.
identifican. Esta
What we
gráfica
can
es
see
por
now,
fecha
it's a
de
situation that you very
ocurrencia
well
de la
know.
defunción
This graph
y
is
por lo tanto
measured on
distribuye a las
the death
defunciones
date,
por
and
fecha de
hence
ocurrencia.
it
De modo que cuando ven ustedes el
separates
cambio de
the
un día
death
para otro,
in
estamos
which day
hablando
they
del
happen.
cambio
So
en
when
lo
you
que
see
se
a
reporta,
major
en lo que
change
se
from one day
informa
to
cada
another,
día. Y
we
eso
are
que lo
looking
informamos
at a change
directamente
on
en
the
tiempo real,
report that we get
pero
every single
corresponde
day, and
con
we do
lamentables
report that
defunciones que ocurren a lo largo de varios
live
días y
every single day.
estas se
But that has
representan
to
en la
do
altura
with
de las gráficas.
unfortunate deaths that
Volvemos a hacer
happen every
énfasis
single day,
en que
and you
observemos
can see this
esa
in the
altura de
different
las
heights
gráficas
presented in the
donde se
chart.
encuentra el
So
punto
when we see
máximo
this
de
particular
mortalidad.
height, when
De
we have
todos modos, es muy
our
claro
highest
que esto
death
sigue en
peak,
ascenso, aunque hay una parte un poco más plana
anyway,
de la
this
curva, pero seguirá en ascenso en la
particular
medida en que la
curve
epidemia siga
continues to
activa.
rise,
Eso es muy
and it
lamentable,
will
pero es
continue
una
to rise for
realidad.
as long as the
Mientras la
pandemic is
epidemia siga
active.
activa y
That's
va a seguir
unfortunate,
activa
but that's
todavía
our
por
reality.
varias
For as
semanas,
long
como
as
lo
the
hemos
pandemic
dicho,
is
vamos a
active and
tener
will continue to be active
lamentablemente
for several weeks,
defunciones. Lo que es
we will
importantísimo,
unfortunately have
extremadamente importante,
death.
es que las
What's
personas
extremely
tengan la
important
posibilidad de
is that
acudir a
people
atención médica si
do
están en
have
riesgo
the
de
opportunity
complicarse
to reach
y que
out
lo
for
hagan de la
hospital
manera más
attention if
temprana
they
posible.
are
Por eso
facing complication
frecuentemente
risk,
repetimos este
and they
mensaje.
should do it as
Si usted es
early
una
as possible.
persona que
That's why
tiene
we
alguna
constantly
enfermedad crónica, en
repeat the
particular
following message.
hipertensión,
If you
diabetes,
are
obesidad
someone
o
who has
tabaquismo,
a
es decir,
particular
fuma,
disease such like
consume
obesity,
productos de
diabetes,
tabaco, ya
or
sea
smoking problem,
por
or
combustión o
you
utiliza vapeadores
consume any type
y
of
además pudiera
nicotine
ser una
products
persona
such as
mayor de
vapes or
65
cigars
años en
or
cualquiera de estas
cigarettes,
dos
or if
condiciones
you are
o es una
older than
mujer
65
embarazada
years old in
y
either of
presenta
these
síntomas de COVID,
conditions, or
no
you are
se
pregnant
espere, por favor,
and
no
you
se espere,
have COVID
acuda a
symptoms
atención
and
médica,
you are exhibiting
porque si se
symptoms, please
identifica
do
que tiene
not wait.
COVID y que
Reach
tiene
to your
algunas
practitioner right
manifestaciones
away,
tempranas
because
de
that could mean that you
complicación,
do have COVID
existe una
19 and
mayor
you're having
posibilidad
some
de
early
que sea
exhibits for the symptoms,
atendida o
and there is
atendido.
a higher
Y
probability
en una
that
parte
you get
importante de los casos,
the
tan
hospital
solo
service that
el
you need.
utilizar
In a large
oxígeno
number of
sin
cases,
necesidad de
just
intubar,
by using
cuando no hay todavía un
oxygen without
daño pulmonar tan
intubation,
extenso
when
o
there is
donde la falta de
when there is
oxigenación
not
no ha sido tan
an
prolongada,
extensive
eso
lung
puede
damage,
ayudar
or where the
a
lack of
que su
oxygen hasn't
organismo
been present
resista,
for that long,
resista
that could
mientras
push the
pasa el
organism to
proceso natural de
endure
recuperación de los
for
pulmones. Eso lo hemos
to
explicado a
endure the
veces con
natural
mayor o con
recovery
menor
process
detalle,
for the
pero
lungs.
queremos que
We have
quede clara
explained
esa
this
idea.
either at higher or smaller
Si una
detail, but
persona empieza a
we
tener
want this
deterioro
idea to be
de la
perfectly
función
clear.
pulmonar, sus
If
pulmones se han
someone
dañado
starts to have
por
a
efecto del
deterioration
COVID,
in
del
their
virus
lungs,
que ha causado
and it has
inflamación
been
y
done
destrucción
so because
del
of
el
COVID
interior de
19
los
due to
pulmones,
the
de las células de los
inflammation that it
pulmones,
causes or
lo
the
que ocurre es que
destruction that
empieza
it
a
causes
perder la
on the
capacidad de
cells
oxigenar la sangre.
of the lungs,
Y si la
what
sangre
happens
no
is
está
that
oxigenando, no
the
se está
blood does
oxigenando
not get
correctamente,
oxygen.
los
And
distintos
when that
órganos
situation happens,
vitales,
the
los
different organs
riñones, el
across
hígado, los
the body
distintos
that are
órganos
considered vital,
empiezan
like
también a
kidneys
tener daños.
and others, are
Y
not
eso
having
puede
oxygen
llevar
either, and they
algunas
start to
horas,
present
a
damage
veces
as well.
algunos días.
These
Pero si
can
eso
take
se
some
logra
days or hours,
evitar,
but
porque
if
se
that is
usa
accomplished
oxigenación, se le pone una
and we get to
mascarilla con
stop it
oxígeno,
because
se le
we
ponen
use
una
oxygen,
sonda, unas
we put
puntas
in a mask,
nasales
an
con
oxygen
oxígeno,
mask,
eso permite en algunos
and other
casos
tubes
que
in
no
your
haya
nose,
ese
in the
deterioro de la
nostril.
función
That
de
will
órganos
allow, in
críticos.
some cases,
Y eso puede
that we save the
aumentar
lungs
las
and the
posibilidades de
critical organs
recuperación.
are safe, and
Contrario a
that can
lo
increase
que puede estar
your
ocurriendo,
probabilities
desde
for
luego la
recovery.
situación más
Unlike
desafortunada es
what
que la
might be
persona se quede en
happening
casa
elsewhere, of course,
y
the
que muera en
most
casa.
complicated situation that
Es
may
la
happen is
situación más
that
desafortunada.
they stay at home and they die
O
at
que llegue
home.
al
That's
hospital,
the
pero ya en una
most
condición
unfortunate
de
situation there is.
importante
Or
daño, de
they do
importante
reach the,
deterioro
the
de los
hospital,
distintos
but
órganos
they
y
are
prácticamente
severely
muere
damaged
en
already
una
for the
situación en
different
la que no se le
organs,
puede
and
recuperar. Por favor,
he or
si es
she
una
reaches the
persona
hospital
con las
in a
características de riesgo,
condition in which
acuda
we cannot do
prontamente
anything about
a
it.
atención
If you
médica.
do have
La siguiente,
the
por favor.
vulnerable characteristics
La
that I mentioned
distribución
do
de
get
estas
medical
lamentables
help right
defunciones
away.
en las entidades federativas
On
no ha
this chart, you
variado,
can
se
see the
presenta el
distribution
mismo
of these
orden, como
unfortunate
pueden
deaths
ver,
on
en
the
las
different
entidades
states.
federativas,
It
de
hasn't
acuerdo a
changed. You can
la
see that they
ocurrencia
are the
de las
same.
lamentables defunciones. La siguiente, por favor.
and they are distributed
En la
as
siguiente
the deaths
vemos,
have
como
been
siempre,
reported in the
los
different
casos
states.
confirmados,
On the next chart, you
81.400 en
can
esta
see
ocasión,
the confirmed cases, which is
36.131 que están en un
81,400,
proceso de estudio y
and the
también
ones
esta
that are
curva se
labeled
representa
suspicious, which
por
are
fecha de
pending
ocurrencia,
under testing,
no por
it's
fecha de registro.
36,131.
Es decir,
And
es
again,
parecida
this
la de
is dated
mortalidad.
on
Aquí
the
cada
occurrence
persona
date and not on
que
the
está
register date. This
representada en
is
los
similar
números
to our
se
death
pone en
rate
la fecha
chart.
en
Every
donde
person
empezaron sus
which is
síntomas.
represented in the
Y como hemos
numbers,
dicho,
we write
de
down
acuerdo
the
al
name,
tiempo que
the date
tarde la
in which
persona
the
en
symptoms were
acudir a
first
atención
exhibited,
médica, puede
and then
haber un
after,
retraso
when
entre
it's
el inicio de sus
confirmed. And when they
síntomas
go to get
y el momento
hospital
en que se
attention,
logra
there may
confirmar
be a
y
delay between
registrar.
the moment they began to exhibit
La
symptoms
siguiente.
and the moment they get registered and
Nuestra curva
confirmed.
acumulada de casos es esta curva ascendente en
Our
la medida en que no se ha
cumulative curve
llegado al punto de
is this
inflexión de la
ascending
epidemia en
curve,
su conjunto. Recuerden
this
esto,
rising
puede
curve.
ser que en
We
algunas
have
entidades
not
federativas,
reached
es
an
el caso de
inflection point
Quintana
for this
Roo,
pandemic.
es el caso
It
de
might be that
Tijuana,
for some
es
states
el
in
caso de
Quintana Roo
Culiacán.
or
Ya se llegó al
Tijuana
pico máximo,
or
ya llegó al
Culiacan,
punto máximo y ya están
they
en
have
un
reached
declive
its
sostenido.
highest
Incluso Villahermosa,
peak
Tabasco,
and they are
está ya
already
en declive, en
going down
disminución. La
in
Ciudad
a
de México
longer
está
term.
justo en la
Even
cresta,
like
ya
Tabasco is
empezamos a
already
ver
flattening
señales
that particular
tempranas
curve.
de reducción
Mexico
en el
City is
número de
at its
casos con
highest
algunas
peak, but
variaciones.
we do start to
Ayer
see a
tuvimos más
reduction on the
casos en la
number
Ciudad
of
de México
cases
de
with
los que
some
habíamos tenido
slight
anteayer,
variations.
a pesar de que
We did
llevábamos
have
ya
more cases
6 días
yesterday than the day
corridos
before,
de una
even though
reducción.
we were already
Y cuando consideramos
redu-
el
re-
conjunto de las
reducing this
epidemias
curve for six
localizadas
days and a
que
run.
se suman en esta
And when
curva,
we do
en la medida
gather
en que tenemos
all the
todavía varias
all the
ciudades que
pandemics
apenas están
focalized in different
empezando
states,
su periodo de
we still get to
transmisión
see that
y
there
se
are
encuentran
several
en
cities are
activa
that they are
dispersión
at the
de los
early stages
contagios, la
on
suma
their
sigue
transmission
aumentando.
rate
Para el
or
nivel
their
nacional,
exhibit
la
rate.
suma
So the number
sigue
will
aumentando.
continue to grow at a national
Y
level.
hoy tenemos 81.400 casos porque se sumó
And today we have
3.377 que
81,000
representan
plus
el
cases because we
4.3%
did get
de lo
an
que
addition of
teníamos ayer.
3,000 that
La
represents
siguiente.
4.3% of what we had
Finalmente,
yesterday.
tenemos el informe de hospitalización, de
Finally,
ocupación
we
hospitalaria.
have
Aquí la noticia
our
positiva es que
hospital
hemos logrado
availability.
mantener
Our
disponibilidad
positive result
hospitalaria.
here is that we have been
39%
able
en el nivel
to hold
nacional,
on
como
to
se puede
our
ver aquí.
hospital
Esta es la suma de
availability,
camas disponibles
39%
para
at a national level. This
atención de
is the
infección
total of
respiratoria aguda
beds
grave. La
available
siguiente, que ya
for
están ustedes familiarizadas y
acute
familiarizados con ella.
breathing
En el
diseases.
extremo derecho se
And the
ve
next one, which
el
is a chart that
porcentaje
you are
nacional,
familiar with, this
40% de
bar
las
chart
camas de uso
shows
general
you on
están
the
ocupadas, ya
right,
hay una reserva de
40% of our
60%.
general bed
Si lo vemos por entidad
occupancy is
federativa,
already
tenemos los números
there,
que se
and there's an
representan aquí.
availability of 40%. So
68% de
you can see the
ocupación para la
numbers
Ciudad de
per state,
México,
68%
67%
of
para Guerrero,
occupation
el
for
Estado de
Mexico
México
City,
con 62
67%
y
for
así
Guerrero,
sucesivamente.
67,
Esta es la parte ocupada,
62%
esta es la parte
for the
disponible.
state of
Y aquí
Mexico,
una
and
buena
so forth.
noticia, como pueden ver,
Red
Guerrero
is the part
ahora tiene menor ocupación
occupied,
de la que
and the
tenía.
golden
¿Cuál es la
one is
razón?
availability. As you
Expansión.
can see now, Guerrero
Esto
has
lo hemos
reduced
venido
its
haciendo
availability.
en las
Why?
distintas entidades
Transmission.
federativas, es expansión.
We have
Cuando
been
nos
saying
estamos
this in the
acercando
different
a
states.
un uso
Sorry,
que
expansion.
pudiera
When we
llegar
are
al riesgo de
closing
saturar, generalmente tenemos como
in
punto de
into a
seguridad
hospital that might be
hasta el
reaching its
20% libre
full saturation
antes
point,
de llegar a demasiada
we say
ocupación
that whenever
y
they
pasar del
only have
80%,
20% available,
se
before we
activan
reach
los
saturation,
mecanismos de
past
expansión.
80%,
Tenemos
we
ahí a
do
nuestra
activate
compañera
any
Rocío
necessary
Bárcena del
mechanisms to
DIF, que está
expand.
muy coordinada con el
Rocio
gobierno del
Bárcena
estado de
from
Guerrero
EIF
y
is already
particularmente en
there,
Acapulco, en donde
working
había
with
la
the
menor
government
capacidad
from Guerrero,
hospitalaria.
and
Ha
specifically
habido
in
esfuerzos de
Acapulco, where we had
expansión
very
gracias a
little
las Fuerzas
hospital
Armadas
availability.
con
We
el
have
plan DN3 y el plan Marino,
implemented
que
some
nos
efforts to
permitieron una de las
establish
expansiones más
some
rápidas
hospitals with
que
the
pudimos
DN3
hacer. La
Army and the
siguiente.
Marine. They helped hospital
Y en el panorama
expansion
nacional,
on a
para
solution
camas
that
con
we
ventilador, es
could
decir,
implement
camas para
right away.
personas críticamente
At a
enfermas,
national level,
tenemos
beds
35% de
with
ocupación
ventilators for
nacional.
people who are
Eso nos
critically ill,
deja un
we do
muy
have a 33%
positivo
available.
65% de disponibilidad. Y cuando lo vemos por entidad federativa,
That leaves
también
a
ha habido
65%
variaciones
very optimistic
porque
for
hoy tenemos a
availability.
Baja
And when
California
we
con
look at the different
67% de
states, we do
ocupación,
see some
es la
changes.
mayor. Aquí
Today,
no es
Baja
por Tijuana,
California has
aquí es por
63%
Mexicali
of bed
principalmente, que es la
occupation.
segunda
That's
ciudad
not
en
because of
tamaño
Tijuana. This is
que
because
está
of
teniendo
Mexicali, which is
actividad
the second
epidémica.
largest city
Pero todavía
that
tenemos
is having
33% de
pandemic
disponibilidad, en el
activity.
Estado de México
We
62%
do
de
still have
ocupación,
33%
38%
of
de
bed
disponibilidad
availability,
y
And
así
in Mexico City,
sucesivamente
we do have
todavía un
32% of
buen margen.
availability and
Esto
so
lo hemos
forth.
logrado mantener y esto es
We
algo muy
still have a
positivo
good margin.
porque es
We have
el
been able
objetivo
to
principal
keep
del
this,
manejo
and
de la
this is quite
epidemia
positive
durante la fase
because our
3,
main
como
goal
ustedes lo
to
saben y
handle
lo
this
hemos venido
pandemic during
comentando.
this phase 3,
Mantener
as you very
siempre
well know, and
disponibilidad
we have been
hospitalaria
saying
para que
so,
nadie
to always have
tenga
hospital
una
availability
complicación o pierda la
so
vida
no one
por el hecho de que
is
no logra tener una cama
left
disponible.
out because
Aquí quiero
they
dar un
did not
brevísimo
get
mensaje
a bed available.
de
And here I would like to take the
referencia a
opportunity to give
mis
you a very
colegas
brief message,
de personal de salud,
and
médicas
that
y
makes
médicos
reference
y
to
especialistas y
our
generales y
healthcare
enfermeras,
providers,
cuando ellas y ellos viven la realidad, la viven
specialists,
intensamente
doctors, and
en el
nurses.
contexto de su
When
hospital.
they are living on the day-to-day
Y ellas y
basis,
ellos están
they
viendo
live
lo
the
que ocurre en los
reality in the
hospitales y
framework
hay
of their
varios
own
hospitales,
hospital. And they
concretamente
are
tengo
looking
ejemplos de la
every
Ciudad de
single
México,
day what's
que
happening in
llegaron a
the
estar
hospitals.
completamente
I
ocupados,
have very clear
completamente
examples
llenos.
that
Y hay
got to
varios que
be
siguen todavía
completely
completamente
full,
llenos. Entonces,
and
estas
some of them
cifras, estos
continue to still
porcentajes de
be
ocupación,
completely full.
se refieren
So
a
these
todo el
numbers
conjunto de
and these
hospitales que están
occupancy
en una entidad
percentages,
federativa.
they represent all of the
Entonces, esto es
hospitals
muy
that lie
importante
in a
porque
specific state.
la
So
perspectiva que
for us,
tiene
this is
el
very
personal de salud
important
es una
because
perspectiva de mucho
the
estrés, de mucha
viewpoint on the
presión,
healthcare
al ver que
providers is
localmente está
a
saturado
viewpoint
su
of stress
hospital. Pero aquí es muy
when
importante y
knowing
por eso
that the
me
hospital is
dirijo a ellas
completely
y ellos,
full. And
no
this is
perder de
why it's
vista que
important and I
existen
want to address them
otros
right now.
hospitales y que
Please
existe un mecanismo de referencia, un
don't
mecanismo de
forget that there are more
envío
hospitals
de
and there is
personas
a
enfermas
reference
a
mechanism so that
otros
you can
hospitales.
send
Y hemos repetido el
people
número
to other hospitals.
911, es el
We have
número universal de
repeated
emergencias. En todos
that
los hospitales,
911
en
is
todos los
our general
turnos,
emergency
debe
number
haber un
for all
grupo o
hospitals
al
for all
menos una
shifts.
persona que esté
There should be
operando
a
la
group
referencia
or at least one
contrarreferencia.
person
Y si la
that
médica,
might
el
be
médico de
operating on
guardia
the
de
reference
turno,
and counter
la persona
reference
líder del grupo
system,
clínico,
whether that's the
identifica que
on-guard
está
doctor
saturado el
or the
hospital,
shift
lo
change,
más pronto
whoever.
posible,
Whenever
la
the
persona
leader identifies
designada
that the
por el
hospital is
director
full,
o directora del
as
hospital
quickly as possible,
debe
whoever
coordinar
was
las llamadas
appointed
al
by the hospital
911
director should
para empezar a
coordinate
derivar pacientes lo más
911
pronto
calls
posible.
so that they can start
La siguiente.
moving patients
Esto
around as
muestra
soon as
cómo se ha ido
possible.
expandiendo la capacidad hospitalaria. Hoy tenemos nuevas
This
expansiones.
shows you
Varias de
how
ellas son
hospital availability
precisamente
has
lo que ha
been
ocurrido
expanded.
en Guerrero
We have
y en Oaxaca algunas
different
y en
aspects
otros
of this
estados.
showing up, like what
Empezamos con
has happening in
645
Guerrero and
hospitales.
Oaxaca and other
Tenemos
states.
ahora
We began with
781
245
hospitales
hospitals.
COVID
We now
designados
have
para la atención de enfermedad
781 COVID-19
respiratoria aguda grave.
hospitals to
La
take care of
siguiente,
this
y creo que es la
particular
última,
disease.
es esta. Esta la he querido
And my
poner
last
un par de días y
statistic, I
hoy
think I
creo que es
want to
una
show you
ocasión útil porque
for a couple of
esto es
days now,
parte del
and I
trabajo
believe that today is
excelente
quite
que hacen
useful
las
because
comunidades
this
académicas de
shows the
matemáticas y
excellent work
matemáticos
on
que
how the
coordina el
different
Consejo
mathematician
Nacional de
and
Ciencia y
science
Tecnología. Lo voy a
departments
explicar
that
de
are
manera muy breve
coordinated by under
porque además es un
CONACYT
ejemplo virtuoso. Esta la
are
hemos
doing.
tomado de
Let
Hidalgo.
me be
En el
brief
estado
on
de
this because
Hidalgo
this is a very clear example. This
hubo
is Hidalgo
un
as an
momento en donde
example.
la movilidad en el espacio público era
At
excesiva,
Hidalgo,
era
we had a
demasiada.
moment
Y aquí
in
mismo en
time
la
in
conferencia
which public
de
mobility
prensa
was really high.
presentamos
And in this
periódicamente los
particular
índices de
media press
movilidad, por
conference,
cierto que
we
CONACYT también
showed
nos
the
ayuda
different
con esos
mobility
índices de
indices
movilidad a
that CONACYT
monitorearlos, a integrarlos, a
also
analizarlos
track down
y
and
los
surveil
presentamos
them
aquí.
and analyze them
El gobierno de
so that we
Hidalgo
can have them to
identificó que
present
había
it.
sido mencionado, entre otros,
Hidalgo's
como un
government
estado de
identified that
exceso de
they
movilidad.
were mentioned
Y
as
literalmente 24 horas después,
a
a
state that
través
had
de la
an
oficina del
excess
señor
in
gobernador
mobility. And
Omar
24
Fayad
hours
y
later,
también
through
de su
the
secretario de
governor's
gobierno,
office,
empezaron
Mr.
a poner
Omar, and
rápidamente
the
en marcha una
Undersecretary of
serie de
Government, they
estrategias o de
quickly
intervenciones que ya tenían
implemented
contempladas y que
some
algunas ya habían
strategies
estado
and
instrumentadas.
interventions
Una
that
de
were
ellas fue
already
el hoy no
thought
circula.
of and
El
were
hoy no
already
circula
meant.
sanitario,
And one of
en
them
donde es
was
análogo al
the
que
no
tiene la Ciudad
circulation
de México,
policy
en
for
donde no
vehicles,
se puede circular, pero
which
no
was
por temas
regulated
de
and
contaminación
sanitized.
ambiental, sino por
And you cannot
disminuir la movilidad en el espacio público,
necessarily do
es
them,
una medida útil,
you
muy
cannot
útil
necessarily
para reducir la movilidad.
drive your car, not because
Entonces
of the
eso hizo el
environmental
estado de
issue, but
Hidalgo
because of the
y vimos un
transmission
cambio
issue.
positivo.
That was very
¿Qué se
important to
explica en la
reduce transmission
gráfica?
in Hidalgo.
Es
That's
quizá
what they
un
did,
elemento
and we
demasiado
saw a very
técnico,
good positive
pero aquí
result.
ustedes han oído
What can
hablar
you
de
see
un
on the
número,
graph? It
de
might
una
be a little
variable
bit
que se llama
technical,
R.
but you have
R
heard of
es
a
el
number
número
and a
de la
variable that's
producción de la
R.
epidemia. En
R,
términos muy
it's the
simples, lo que quiere
number
decir es
of the
cuántas
pandemic
personas se van
reproduction.
a
What that
contagiar
means
a partir de una persona enferma
is
durante el
how
periodo que
many
esa persona
people will
enferma sea
be
contagiosa. Eso quiere decir
transmitted
R. Cuando se estima
during the
R
period in
al
which the
inicio de la
person who is
epidemia y
infected
bajo el supuesto de que
is
todo mundo es susceptible,
transmission
se le llama R0.
its transmission available. So when we do have it on, like, let's say 0 and over course of the different days, we continue to label it as RT, meaning R in the specified time, 1 day, 2 days, 3 days. But this particular measure of R, it's an important variable in the mathematics of pandemic because it has an intuitive interpretation of what might be happening with the transmission. So if R is higher than 1, the pandemic continues to grow. If R is minus or lower to 1, the pandemic continues to lower. If R is just 1, the pandemic keeps in place. So our goal by our intervention of prevention and control is that R is on minus 1, and that's not easy to achieve. That requires a lot of intervention, but on our newest report that we have received from these authors that you can see on your screen down to your left, both from a CONACYT group for mathematics. They allow us to surveil the pandemic live, literally. Let me show Hidalgo. They were very successful. When they first began to implement their driving policies and others, the transmission rate quickly began to lower, and other states had a similar success. There has been some variables, but this undoubtedly shows how the pandemic is behaving. Thank you so much. Dr. Hugo.
Muchas gracias, doctor Hugo López Gatell. Muchas gracias por invitarnos. Bueno, pues desde enero que se anunció la posibilidad de que llegara esta pandemia a México, el CONACYT, bajo el liderazgo y el mandato del presidente de la República, quien desde un inicio mandató el tener un enfoque científico frente a este gran reto, tanto al interior de la Secretaría de Salud.
We were instructed to take a scientific focus both within the Ministry of Health as well as all the entities that could join with our capacities. At CONACYT, what we did was to start a research project on the incidence of COVID-19. We've organized a series of actions that have been explaining the scientific aspects and technological innovations in the country. We've been rolling this out in both public and private universities, as well as at public research centers that work with CONACYT. So today we're going to be presenting one of these efforts, which is a national computer ecosystem for COVID-19. At CONACYT, we propose to integrate this with a national system with other intelligence systems in order to support different aspects of the public management of the pandemic. It can also help the problems in this country, not only in the health sector. We are specifically integrating this initiative by appealing to academic institutions and colleagues who have experience in mathematics or simulation, computation, and computer science. And we're asking them to focus on different areas. Next slide, please. These are the research areas that we're focusing on. We are looking at scientific data on the disease that is currently available to everyone around the world. There's a very large amount of data and information being put into the directory, and it's covering different areas such as epidemiology or evolution of the disease. And the directory has already been visited a lot. This is one of the resources of the national computer ecosystem that we have. So integration, treatment, and data analysis. And this is something being done closely with the Ministry of Health, with Dr. Jorge Alcosot, in coordination, sometimes on a daily basis. As Dr. Hugo Lopez-Gatell has mentioned and has been explaining some of the challenges for the scientific community, as well as at CONACYT. We are coordinating this project directly at the head office. We're also talking about modeling the dynamics of the disease, because this is a contagious disease that has a dynamic that really is based on very complex factors. We can never predict the reality. Things can never be the reality. They are very useful instruments, and they have been in our management of the pandemic. And they can predict or forecast up to a certain point how the peaks are evolving and changing across the country. So based on some of the models that we had, which we will be showing, and that Dr. Lopez-Gatell has been showing every night, one thing that we found is that the lack of coordination among the very different disease peaks across the country also allowed for more scaled management of the efforts. We also have mathematical calculations of the disease across the country. In terms of information dashboards and tools, we're going to take this national computer ecosystem in its public form. It currently resides in a place within CONACYT, but is constantly associating and linking up with other databases coordinated by the Ministry of Health. The fifth area is spatial and geographic areas using geographical information systems, which are very important. And in the next phase will be particularly relevant. On the next slide, there's a list of the different models and the analysis. It's not a completely exhaustive list, but on the site, you're going to see that a lot of the results have been downloaded. We have the AMA model, and that has to do with the initials of Antonio Capella from the University of Mexico. And we're going to show the list of the names of all the colleagues who have been collaborating in this project and very committed to it. There's Mr. Capistrana is another one of the authors who have been working on this since January, dedicated to working on this model. And this is one of the models that has been used to create the forecasts. We also have the Compert's model, which was created by another colleague from CIMAT, Dr. Marcos Capistrana, and Andres Christensen from CIMAT. This is another CONACYT center. And it was also developed by Dr. Graciela at the same center. There's an estimate of the effective reproduction rate for COVID for the states and metropolitan areas of Mexico, as we have just seen. Later trends of new cases of COVID-19, and these will all be very important factors going into the stoplight. So some regional analysis, which are being carried out by Paula Villarreal, who is with us tonight and who has been a very valuable contributor to this project. She will soon head a new coordination group for research directories. We also have a collection of confirmed cases, mobility data, and information dashboards on COVID-19 and different repositories. This just summarizes for you some of the institutions that have been contributing to the project. So this national ecosystem, of course, is open. There's an appeal to all of our colleagues who work in these areas to contribute and help us work towards some of the goals that we have set. These public centers like CIMAT Infotech are some of the public research centers under CONACYT. CONABIO is a very important organization that is under CEPERMAT. INEGI, which is the Mathematics Institute of UNAM, are just a few of the institutions that have been participating most actively in this project. Next. Here we wanted to include the names of all the researchers and contributors. Hermosillo Julieto, Álvaro Soso, Barranco Pérez, Capella Cord, Capistrano Compo, Chamizo Alberro, Kristen Gracia. Others will also be joining the team as well and creating a new team within CONACYT. Christian Garcia, Jose Andres, Esquivel Vázquez, Judith Estrada, Alfredo, Garduño Magaña, Gómez Ulibarri, González Faria, and González Vázquez. Graciela is the one who has been doing the estimates and the calculations together with CIMAT. Later, Huergo Villalobos, Lagunas Ledesma, Lemus Cuevas, and Lopez Ramirez. So this is why I didn't want to give all of the information here of all the colleagues and institutions or the projects that CONACYT is working on, because you can see their affiliations and the specialties of these contributors on the site, as well as a card, information card on each of these colleagues who have so generously contributed their time and their work, working many times day and night, so the project can be successful. This is the website. So it's coronavirus.conacyt.mx. And then I'm going to ask Paola to give you a few examples of the site and what you might be able to find on it. Thank you. Thank you, Dr. Álvarez Bulla. It's a great honor for me to be here, this evening at the National Palace and representing such a huge team of scientists. There's 35 working actively. And through our work is being summarized on this microsite. So it's coronavirus.conacyt.mx. So everyone who is listening can visit the website and browse together with us. In the beginning, it's important to read a little bit about what CONACYT does and the work that it is doing. But something that is really important are the projections. And these are the projections we decided to put on the homepage of the website. And these are among the published ones that we have been talking about for almost a month and a half now. And we've been updating it periodically. For example, in Mexico Valley, in the Valley of Mexico, in Mexico City in this case, these are the forecasts that have been published. As Dr. Lopez-Gatell has mentioned, the median is the red line, and there's a 90% probability that the number of cases, the blue bars, will fall within this range. Then if you click on views or displays, and this is also part of the site navigation, we can see the mobility indexes that is presented every Tuesday by Dr. Cortez Alcala. This is the historical mobility across the country for this year. And these are calculated by Twitter, Facebook, and Google data. Here we can see how mobility was reduced as of March, and we're about at a 52% reduction. Here's the reduction in mobility on map form. You can see states such as Durango, Zacatecas, Nuevo León, and Tamaulipas, those states all have a reduction level that is not so optimal. They're at 42%. Then beneath, something quite interesting is a comparison of mobility levels. And this is over the last 14 days and then the last 7 days. So, for example, Baja California increased its percentage by 11% in 14 days. And 7 days ago, if we minus it, that equals 11%. So that tells us then that its mobility is increasing. I think this one is the last graph. So there's other sections and other views available on this site. For example, nationally, and then also state and municipal level. If we look at the state view, up top there. Yep. Thank you. Hang on a second, just a little bit. And so if you can click on projections, so this site was also designed to be used on cell phones. This one is on a computer, but we really made a great effort to ensure that it could be browsed on cell phones as well, and not just on computers. So these are projections by state. We're publishing 2 models right now, but there are many more on the way. And this is the AMA and the COMPETS models. They've got many interesting graphs. Looking at the daily cases, it's been presented many times, but if we go down a little bit, on the left, the graph shows the same thing, but we've got the projected epi curve into the future. This one I think is specifically about Aguascalientes. Then we have the projection of number of deaths, which isn't published. And this is cumulative, and that's important to note because the graph on the left is how many cases occur every day, and on the right, it's how many cumulative cases have occurred. And scrolling down, we have other projections as well, which is hospital demand, which was presented by the Ministry of Health, and the entire federal government is in charge of the logistics. So it's how many ICU beds are needed and how many general hospital beds will be required. In order to be a little more brief, we have the same types of navigation views, but on metropolitan level. But something that's important to point out is the research points, or so the research products. If you click above, for example, these are formal jobs, or the formal jobs of the research team. It can be downloaded. And it shows the raw data or the raw work of the researchers. These are all the authors. Down here is the AMA model. We have the authors as well as all of the reports that they have published and that are updated. And then the Gombert's model also has its own reports. And little by little, we will be updating the repository with all the information that is being produced by this research team that comprises right now 35 researchers, but we expect that others will join us soon. So that's basically all for me. Thank you very much. So now let's start with Olinka for our Q&A. You as well. stoplight that you're going to be presenting tomorrow is the measure being approved by the Health Institute. And yesterday you said that the press briefings were not yet defined, but in the morning you would decide if they were going to be coming out. And so I'm wondering about the logistics of the president's agenda and whether the epi stoplight might mean that some states are in orange, for example, and then comparison under legislators. You said there were several models about the epidemic. Can you explain some of the scenarios? Thank you, Olinka, for the questions. With respect to the president's work, or these supervisory visits that were mentioned, it's important to note that, as we mentioned yesterday or the day before, these are not mass visits. It's not large meetings or gatherings in any way, no. That's not the intention. It's to supervise strategic projects that are extremely relevant to the development and social welfare. If these visits do happen, as we said yesterday, I think with Mr. Santomino, who's not here, it's going to be highly controlled, maybe a capacity of 40 people. He himself will be standing away from people. So the Mexican people need to understand that right now they cannot get closer to him, but they cannot get close to one another. And so whether that's decided tonight or not, do not go and gather to where these visits will be taking place. Yes, the stoplight, to answer the other one, is general, but it doesn't contemplate these visits. So throughout the National Safe Distancing Campaign, essential activities have continued. As you know, the agreement with the Ministry of Health from May 30th, the 30th of March. This agreement stipulated essential activities, and that was government work. Another one is communication. You know, you guys are here every evening. There's many more too. So those activities will continue and have continued, but they have to be carried out in a controlled fashion. Wondering if the stoplight was approved? Question cannot be heard very well. Can you explain them, please? It's a very good question. It's very important. And that's specifically why Dr. Alvarez Buya is here. So about the other two, so I don't miss them. The stoplight doesn't need to be approved by the Health Council. It's been already approved by the other federal health authorities. There's 3 of them: the President, the Ministry of Health, and the General Health Council. So the General Health Council has several powers, one of which is to declare a state of emergency. That's what happened before. And then the Ministry of Health has the power, according to the constitutional articles in section 63(6), is that when there is an invasion of an exotic infection, blah, 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 whatever it says, is that they can order extraordinary actions. So those are immediate actions that need to be initiated. And those have appeared in successive agreements. And later, an agreement will be published that details the specifics of the stoplight. And again, on May 15th, there was an agreement published on the stoplights about models. Thank you, Olinka, for mentioning it. It's been a few weeks now that we've been having dialogues and technical discussions with these academic groups. And these discussions are about projections of scenarios of reopening, lockdown lifting, and the end of the national safe distancing campaign. We've been putting special attention, as you have asked me before, what might happen in the case that if the reopening or lockdown lifting is too fast. There will be a new outbreak. There will be another wave. And so I want that to be clear to everyone. If we go back out too soon, there's going to be a new wave. So everywhere that the lockdown has been lifted, there have been second waves. And so we need to keep restrictions on our mobility. One of the elements identified is that the number of people who go back into public life or public activities, whether it be work, school, or recreational, the number of people has much to do with the possibility of a second wave. A second thing that really determines it is the level of mobility. Just to put it hypothetically, to say if 5,000 people go out into the street, but they only go out in the small area around their house and do things nearby. Compare that with those same 5,000 people move from one end of the city to the other or between different municipalities. The models that were shown here, there's many different ones that shows us different scenarios. And that's very important because this is what this stoplight is designed upon. Tomorrow, we're going to hear additional details about the design of the stoplight and how the participation of both state governments is crucial in order to provide details of how this will happen in the reality in their states. Now, Salit, next.
Es referente a la reducción del 75% del presupuesto operativo que impacta a centros públicos de investigación. Mi pregunta es, ¿esta reducción presupuestal
75% of the budget affects research institutions. So is that reduction in the budget, is that general and irrevocable? Or could the requirements be revised for each center in order to determine specific amounts? Could there be a plan B so that some scientific research programs are not harmed if they are going to help the development of the country? Could you talk us about the models for the ventilators that came out on 15th of May? And also, Dr. Gattel, yesterday you mentioned a guide that was published about the serological testing. Yesterday you mentioned that half of them are false. So the guide that was published, how does that impact what's happening in Mexico? Because you said that they already started these types of tests. And I also want to know if you will have health promoter staff for people who are at home to be visited at home. And that's something mentioned with the governors. And also for Dr. Gattel, in September, it's flu season. So we're going to be coming out of COVID at that time, but into flu season, and we'd like to know what would be the plan in that case. Thank you very much for those questions. So scientific and technological development is crucial to the Office of the President, and it won't be reduced, it will be increased, specifically with regard to training of specialists. But there's always been a priority on maintaining and supporting scholarships, for example. So the savings to the government are being taken or taking into account the specific situations of each of the entities that are involved in some of those substantial activities fighting the pandemic, but also activities that should not be affected, like research centers and such as higher institutes of higher learning. To the federal government, this is clear, and so there should be no concerns about that. So not only have we bolstered the financing capacity, CONACYT's financing has increased. One of the orders of the president was to have CONACYT focus on building ventilators. And so this is not just for emerging cases, but also industry that will save lives. So have no doubt that it will be that way. And those national developments that were designed and the technology transfer to companies who are supporting us together and doing that without any profit motive. All of this is, kept in memory. These are all recorded, and so you can go back to my presentation, and you'll see that I clearly stated that the formal proposal was to start construction of those ventilators on May 15th, and that in fact happened. They are being built, and the technology transfer phase has begun, and the manufacturing of the first ventilators has happened. There was another reporter by asking me if they would be ready or when they would be ready. And so I said from the bottom of my heart, and I still maintain the same thing, that we will try to do everything that we can do. Not only has manufacturing started, but we hope to have those ventilators ready to be delivered and used. That could not have been possible because of the complex sectors in the market. And an important component of those ventilators came from two national developments, and the majority of the components are domestic. They're manufactured in Mexico. However, perhaps some of the most critical components are in demand across the globe. And it's that demand that is causing a delay in the manufacturing and assembly of this equipment. But it's very important. The concept is being demonstrated that in Mexico we can give ourselves the capacity and manufacture what we need. And in this particular case, we are looking at the gestation and very soon the birth of a domestic industry. These are not only developments by CONACYT, but also other institutes, such as the National Nutrition Institute. There are other ventilators also that have been proposed from other public entities, and they're at different phases of development. So we are all at CONACYT working hard towards the birth of this ecosystem that I mentioned and a series of national industries that will save lives. So because based on this, we will be able to come up with other useful developments in the healthcare field. And we just have 2 minutes left. So what do you prefer that I focus on? Serological testing? I know I owe you that explanation, but I can't give a really detailed explanation when they would be used, etc. What about the health promoters that will be going house to house, for example? In fact, the flu season in the northern hemisphere, US, Canada, Mexico, Russia, part of China, the majority of its country, as well as Japan, the entire northern hemisphere will see a flu season in roughly October, end of September, early October, up until April of the following year, so 2021. This happens every year, and it's been happening for centuries. I don't know about thousands of years, but at least centuries. But we can guarantee it's going to happen. It's an undesirable phenomenon, and if we look at it from a human perspective, because of course it's going to involve illness, and unfortunately it's going to mean there will be deaths. Influenza is one of the primary causes of respiratory death in the world. So therefore, it's crucially important to be prepared for it and treat it, and not just for epidemics, but the typical annual seasonal flu. In 2018, which is when we have the most recent official statistics for deaths in Mexico, a little more than 72,200 deaths. 28,000 of them were due to respiratory illness or the flu, so either pneumonia or the flu. Why do I say that? Because we can't distinguish between the two, and we'll look at that a little more when we talk about pneumonia and atypical respiratory illnesses. But in vital statistics across the world, such as the International Classification of Diseases, they are in the same category, 28,000. It's going to come. We know it will, and we're getting ready. How are we getting ready? So first of all, we're not going to dismantle the retrofitted hospitals. They're going to stay around until we can see what the pattern of occurrence is going to be of the typical flu and COVID. One thing that we can't guarantee, and there's no formal prediction anywhere in the world for that, but many in the health community, both national and international, we believe that it is likely that between October and April, in addition to the flu, we are going to see another outbreak or another wave of COVID. And this is why lockdown lifting is so important. It's so important not to do it too late, not only for the economic and social impacts that we've talked about many times, but if we wait too long and then we lift the lockdowns, specifically at the moment when we know the flu is coming, so that would be October, November, December, then we are setting the conditions for having an enormous number of people who are vulnerable to COVID, and with no scientific certainty whether or not the illness produces immunity. So if we do that lockdown lifting too close to the start of the seasonal flu, then we are putting people further at risk at that time. So now I'm just going to end with the topic of the health visitors. This is one of the essential functions of public health, and we've had this system in Mexico for decades. We've got specific staff who are health promoters. They're part of a department, usually a health department or health division. We have it on a national level, and Dr. Ricardo Alcalá Cortés is the director. We saw the opportunity to have health promoters and their work contribute to some of these topics we've been talking about, specifically to help people who have illnesses and who are at home and are at risk, that they can still continue to be monitored and receive treatment at their home. So we might be checking for chronic diseases, chronic illness like diabetes, for example, and also monitor their lung function or blood oxygen levels. So people who work in health promotion, let's remember that INSABI redirected the work of over 6,300 managers who previously were dedicated to recruitment or membership of people into the social insurance, social security. So no, we don't need to get anyone to join right now because everybody who lives in Mexico is entitled to health care. They don't need any specific ID or credentials. So that isn't needed anymore. Everybody in Mexico is entitled to go to a health center and receive care. So those slightly more than 6,300 people were rechanneled to be working in health promotion activities. And through that, we've been able to increase the capacity of the healthcare system in the community setting using the model that we have developed for primary healthcare. We've already been putting that forward, and we've had many conversations with the states. Many of the states were already doing it on their own, but now we're trying to make that more formalized across the country. So we're now 4 minutes over time. So thank you very much and have a good evening, everyone. Thank you to Dr. Alvarez and Paula.